A hypothesis on controlling growth rate of pathogens during incubation period. The recent attack of coronavirus has brought the global economy to a standstill.
While we grapple with the healthcare challenges, it is important to restore the right of individuals to grow and work for themselves with least possible risk.
While effective vaccinations are 12 to 18 months away, we cannot rely on herd immunity to bring normalization, due to inevitable collateral pressure on healthcare resources and high fatality count.
The virus is not capable of self-replication. It instead incubates on the back of nasal passages and throat so that it can attack the host cells and use them to multiply.
The average incubation period is 5 days, during which very few or no symptoms may show.
This is where we plan to intervene. The ozone layer of Earth reflects away ultraviolet C rays. UVC rays damage the nucleic acids in the virus and render them ineffective. Their efficacy is proven in ex vivo and in vitro trials.
The idea is to let people work with basic precautions and let the virus spread. As the virus spreads and more people begin incubating it, we intervene, and through a special device, deliver a dose of UVC rays to the incubation sites.
The UVC rays attenuate the virus and delay the incubation. As the virus incubates back, a repeat dose ensures it remains attenuated.
If the current trend of the infection is as illustrated on left, leading to 4% fatality, 20% severe illness and 76% mild impact of symptoms, use of controlled UV dose will bring the pathogen growth down, and lead to more controlled immunoresponse and less aggravation of symptoms.
UV rays are harmful in excessive dose. Indiscriminate use needs to be controlled.
The proposed device consists of 2 nasal probes, an oral probe, and a biometric thumb scan.
The oral probe has an array of UVC LEDs, temperature detector, a light detector, and a pressure sensor.
When held in palm, the thumb overlaps with biometric thumb scanner naturally.
When switched on, the device performs identity scan through thumb biometrics, and relays the identity to a server on cloud.
The server verifies if minimum time lapse of dose is transpired, or not, and transmits back approval to the device.
The device then verifies the deployment by collating data from light sensor, temperature sensor, and pressure sensor.
If deployment is wrong, the user is warned to correct it. If deployment is correct, the dose is delivered.
The device then relays the dose data to the server on cloud.
The dose data consists of dose value with time, temperature, and breath profile.
UVC rays are fairly independent of the pathogen and its mutations. They are wide-range germicidals. The tendency of pathogens to mutate against UVC, though possible, is improbable in near future.
We need support of subject experts and doctors to evaluate if such an endeavor shall be useful or not.